Respected dignitaries of the virtual screen, uh, our guest of honor, Professor Shashikala Vanzari, Madam, our beloved Principal of SVT College, Dr. Jagmeet Madan, Madam, Aussie President and Aussie Secretary, Aussie President Dr. Manish Sir, Aussie Secretary Dr. Randeep, my own team members, my colleague Dr. Satish Pattanchetti, and my Chief Nutritionist Madam Dr. Geeta. It has been really a very happy moment for all of us because we have been working on this project for last 2 years and finally it has come to completion. I have been asked to speak about recent trends in bariatric surgery, and I'll restrict myself to few important highlights. As has been mentioned by our own Aussie colleagues, this used to be story of a bariatric surgeon in the early days of bariatric surgery practice in India, where once a patient gets operated and then if the patient comes to the surgeon, he would refer the patient either to a nutritionist or to a psychologist or to whosoever he feel can give justice this patient. And that's how most of the post-operative bariatric surgery patients used to ultimately land nowhere. And when it comes to patients who have undergone this surgery, patient's story always was that patient wanted us, the clinical care coordinators, to look into his care as a total. So it was always, it's not me, it's you who are going to look into this. And when me and Dr. Satish, we met for the first time as regards to bariatric surgery, we realized that it's not we, the surgeons, but the chief nutritionists who formed the pivot of a successful bariatric surgery program. As we started working together with Dr. Geeta, she came up with an idea that we should have a structured training program for bariatric nutrition course, and then thought of somebody who is a trendsetter. The people of Madam Jagmeet Madan Madam's stature, they are all visionaries. They are not trend followers. This course design has been going on for last 2 years. So we all can understand how envisaging vision Madam Madan has, where it has come up today at COVID times that this course is ready to reach to each and every nutritionist who deserves training in bariatric nutrition. So under Madam's leadership, SVT has been trendsetter for last 25 years and will create so many trend followers in the coming days. If you ask me frankly, has trends in bariatric surgery been different? And I could collate some 5 important points which could relate to today's time. In COVID time of being at home and work from home, the epidemic of weight gain has increased. It's not only has increased, obesity has created polarization and worsening. So people who were fit have become fitter, while people who were not fit have worsened in their general condition. And I think this is one of the biggest trend which will be coming out of the COVID times. Now the next most important change in the perspective or the dimension which has happened is in understanding the efficacy of bariatric surgery per se. and that it is no more just treating weight, but it is also treating the various metabolic syndromes of the patient. I think this change in perspective has really brought a good change in the outcome of bariatric surgery. Well, some people say restrictive bariatric surgery is the trend. Some people say malabsorptive bariatric surgery is the trend. If you ask me, any surgery which constructs the health of a patient, a constructive surgery is the trend. So it's not restrictive, it's not malabsorptive. An appropriate surgery is the trend in bariatric surgery and will remain in trend in bariatric surgery. There are certain expectations which are from the patient's perspective and which are playing a major role when it comes to influencing the decision makings in bariatric surgery. Patients these days are preferring more and more reversible options when it comes to delivering surgical care as compared to non-surgical care. So even if it's a surgical care, their preferences are more inclined to than non-reversible options. This trend is definitely going to be of lot of value when it comes to catering to patients. Most importantly, cost, which was a major prohibiting factor when it comes to undergoing a bariatric surgery, is no longer true. As we all know, since October 2019, bariatric surgery has been covered under insurance and gets sanctioned under insurance if patient is eligible for it, and which is going to be the biggest change in trend when it comes to care offered to bariatric surgery. At this point of juncture, on this very day, 2 years before, I had an opportunity to be with the father of modern bariatric surgery, Professor Alan Whitgraw, and the pioneer of bariatric surgery, Professor Kelvin Higa in US. And in our discussions, when I had a brainstorming with them, both of them had a consensus which probably holds true and will remain with me all my life. Both of them said that, Neeraj, don't think of multiple surgeries as an option for your bariatric patients. Think once and let that be the first and the last effective treatment offered to your patient. And I'm here to quote today that these words have probably will be coming true in today's era after we have bariatric nutrition course getting added in the care of bariatric surgery. So friends, to summarize, bigger trend of increasing weight and continuing improvements in bariatric surgery will be here to stay. Bariatric surgery will play a major part in the treatment options of our patients, and this I will have to humbly accept that the only lasting trend when it comes to caring our own patients is continue to adapt as the time changes. I must profusely thank SVT, all the faculty members of SVT, the vision with which they have come up with this authentic university accredited bariatric nutrition course. The sole reason why I feel each and every nutritionist should consider this, because this course has embedded faculties in dietetics, nutrigenomics, exercise specialty, psychology, and of course, bariatric surgeons. So a must for each and everyone to do. Thank you again. Thanks for being with us, and thanks for giving me a platform.